I'm Dr. Amr Abbasi, MD, Obstetrics and Gynecology, Reproductive Consultant in the Egyptian National Research Center. It's a very new field. It's evolving very quickly, and you always have to, as a physician, you always have to be updated. That's why we're always trying to take new courses. We're always trying to update ourselves. If there's a need from our patients, our role as physicians is to try to fulfill their needs. In my field, in the era of reproductive medicine, we get a lot of patients complaining of dyspareunia, which is failure to have an intercourse with their husbands. And we get a lot of patients that we actually start to use technology like IVF and IUI under anesthesia for these patients. This is really what made me think, why can't we treat the actual cause of the infertility, which is dyspareunia. Also, we get a lot of patients with that have prolapse or have stress urinary incontinence, and if we can find procedure, if we can start to produce procedures like the laser vaginal tightening, and which would cause elevation of the bladder, you can really increase this patient's satisfaction. It will have a very nice effect on their quality of lives. It's very important as doctors to always try to improve ourselves, always to be updated so that we can always make our patients happy. The highlight of the course was, for me, the O shot and a procedure called the O shot and a procedure called filler injection in the labia majora. I think this has a very good application in our area or in our field, because patients, as they age, they start to lose a lot of the fat in the labia majora. They need something to revitalize their tissues. For these procedures to evolve, this means these patients are getting a much better satisfaction during sexual intercourse. It makes them much more confident. It increases their satisfaction with life. I think there's not a big awareness now, but it is evolving, and because of the internet and the social media, people are becoming more aware. But our role as physicians is always try to propagate new technology. But of course, everything that is new, it has to go through a certain processes. Like we have to have randomized controlled trials. You have to have a lot of studies to really prove that these procedures are quite effective for the patients. That's why our role in the National Research Center, we're always trying to research all the new technology, like the erbium YAG laser or the carbon dioxide laser. We're using it for patients that have had breast cancer treatment and that have atrophic vaginitis. We're using the laser to revitalize their vagina and rejuvenate their vaginas. We're trying it in patients with stress urinary incontinence. So we're always trying to improve their quality, and we're trying to experiment these new treatments and make sure, and through the randomized control trials, to make sure that these treatments are actually effective for the patients. I would recommend my colleagues to get enrolled in these courses because, first of all, it is an evolving field, and always in medicine and elsewhere, whenever something is still in the initial process, it's always much more fruitful and it's always much more intriguing to be one of the pioneers in the field when you're involved in the startup of any kind of new process. That's why they have to be updated. You have to read a lot. You have to attend a lot of courses, and this course was very fruitful. Dr. Badr was more than informative. He's a pioneer in this area, and for us to get the chance to work hands-on on patients, actual patients, not just getting certain theories or theoretical information, but actually having the chance to have a hands-on on the patient, this creates a very good opportunity.